Hello, myself Varsha, working as assistant professor in the Department of Pharmacology at Shahadu Chinchindi College of Pharmacy. Today I am going to discuss about antiviral drugs. So antiviral drugs, these are the drugs which are used to treatment for the viral infections. So virus has no cell and made up of nucleic acid component. Virus containing envelope antigenic in nature. Virus are obligate intracellular parasite. They do not have metabolic machinery of their own or uses host enzyme. Antiviral drugs have many purine and pyrimidine analogs. Many antiviral drugs are prodrug. There must be phosphorylated by viral or cellular enzyme in order to become active. Antiviral agents inhibit the active replication, so the viral growth resumes after drug removal. So antiviral drugs, the stages of viral replication, that is first it will be start from the cell entry, that is attachment, and then after it will be penetrate. Then which will be uncoating, the transcription of viral genome, the translation followed by assembly of viral complement, then release. So this will be the attachment followed by the viral penetration. So which will be blocks the N-furetide gamma globins, that is non-specific, that is viral absorption, that will be starts with the viral absorption, which will be penetration, then followed by uncoating, that may be blocked by the amantadine. These are the drugs. So once it is uncoated, then early protein synthesis, then followed by the nucleic acid synthesis, and followed by the late protein synthesis and processing, and packaging and assembly for the viral release. So this is about viral. So some of the drugs which will be blocks their viral absorption when it is absorbed by the time that whatever the N-furetide which is treated for the HIV, that will be blocked there only where it is absorbed. Some of the drugs like amantadine, that is influenza A, which is blocked by the amantadine, that is where that is uncoated. So by the time this particular drug which will be blocks. Then coming to the early protein synthesis, some of the drugs like formaviricin, this will be blocks in the early protein synthesis. And some of the drugs like purine pyrimidine analog and reverse transcriptase and inhibitors, this will be blocks during the stage of nucleic acid synthesis. And some of the drugs, methizazole, that will be during the late protein synthesis and processing. And some drugs, rifampin, which will be in the stage of packing and assembly. And some drugs, this will be neuroamidase, this will be inhibits and block with the influenza, whatever the viruses. Then antiviral drugs, that may be anti-herpes virus. So example for the herpes virus agents, that is acyclovir, valacyclovir, famiciclovir, peniciclovir, then ganicyclovir, then cidofovir, foscarnet, trifluorinide, idoxuridine, vidarbib. So antiviral drugs, that is acyclovir and congress. Valacyclovir is a prodrug of acyclovir with better bioavailability. Famiciclovir is hydrolyzed and peniciclovir and has greatest bioavailability. Peniciclovir is used only topical, whereas famiciclovir can be administered oral route. Pharmacology of acyclovir and congeneris, is acyclovir, valacyclovir, ganicyclovir, famiciclovir, peniciclovir, all are guanine nucleoside analogs. Mechanism of action of acyclovir and congeners, all the drugs are phosphorylated by viral thymidine kinases and metabolized by host cell kinases and nucleotide analogs. The analog inhibit viral DNA polymerases. Only actively replicating viruses are inhibited. So these are the acyclovir. So this will be the mechanism, that is acyclovir, which will be acyclogenosin. The acyclovir, the synthesis of acyclovir, acyclogenosin monophosphate, that is acyclo-GMP. So this will be this will be undergone with the host cell kinases, that is acyclogenosin triphosphate. So again, it undergone with viral DNA polymerase, which is the viral DNA. Then antiviral drugs, that is acyclovir, is thus selectively activated in cells infected with herpes virus. Uninfected cells do not phosphorylate acyclovir. So antiviral spectrum, acyclovir which is having HSV1, HSV2, VZV, and shingles. So gynocyclovir and cidofovir, that is CMV. Then famiciclovir, herpes genitalis, and shinaglis. Foscronet, HSV, VZV, and CMV and HIV. So these are the drugs which will be treated for this type of viruses. Anisaclovir, that is herpes labialis. Trifluoronide, hepatic keratoconjunctivitis. Pharmacokinetics of acyclovir, that is oral bioavailability, that is 20 to 30%. Distribution in all the body tissues, including CNS. Renal excretion, that is 80%. And half-life, that is 2 to 5 hours. Administration can be administered through the topical route, oral route, and intravenous route. Adverse effect, that is nausea, vomiting, and diarrhea, that is for acyclovir and ganicyclovir. The nephrotoxicity, crystalluria, hematuria, renal insufficiency, myelosuppressions, neutropenia, and thrombocytopenia, and also ganicyclovir, which will be treated for this type of disease. Then therapeutic uses of acyclovir, which is a choice for HSV genital infection, HSV encephalitis, HSV infection in immunocompromised patients. Ganicyclovir is the drug of choice for CME rhinitis in immunocompromised patient. Prevention of CME disease in transplant patients. Cidofovir, it is approved for the treatment of CME rhinitis in immunocompromised patients. It is a nucleotide analog of cytosine. No phosphorylation is required. It inhibits viral DNA synthesis. Available for IV, intravitreal injection, topical route. Nephrotoxicity is a major disadvantage. Pharmacology of vidrabin, that is, vidrabin is a nucleoside analog of adenosine. Antiviral spectrum of vidrabin, that is HSV1, HSV2, and VZV. It is used in the limited for HSV keratitis only. So these are the drugs which is converted to triphosphate analog, which inhibits the viral DNA polymerase, and oral bioavailability is 2%. Administration, that is ophthalmic ointment, and used in HSV keratoconjunctivitis in immunocompromised patient. Anemia and other adverse effects. Pharmacology of trifluorinidine. So this trifluorinidine is a pyrimidine nucleoside analogs and which inhibit the DNA viral synthesis. Antiviral spectrum, that of trifluorinidine, HSV1, HSV2, and VZV. Use is limited to topical ocular HSV keratitis. Pharmacology of phoscornet. Phoscornet is an inorganic pyrophosphate analog. It is directly inhibits viral DNA and RNA polymerase and viral inverse transcriptase. It does not require phosphorylation and for antiviral activity. Phoscornet, which is used for the oral availability, is 10 to 20%. Distribution to all tissue, including central nervous system, and administration through the IV route, that is intravenous route. Then adverse effects of this particular drug, that is hypocalcemia and hypomagnesemia, due to chelation of the drug with divalent action. Divalent cations are common. Neurotoxicity, that is headache, hallucination, and seizures. The nephrotoxicity, acute tubular nephrosis, interstitial nephritis. Therapeutic uses of phoscornet. It is an alternative drug for HSV infection, acyclovir resistant immunocompromised patients, and CME retinitis, that is ganicyclovir resistant and immunocompromised patients. Respiratory viral infection, that is influenza. Example for influenza, that is the drugs which are used for the influenza, that is amantadine, rimantadine, zamanavir, then oseltamivir. RSV bronchodilators, that is ribavirin. Amantadine and rimantadine influenza, it will be prevention treatment for the influenza A and inhibitions of viral uncoating by inhibiting the viral membrane protein YUM2. Influenza A viruses, amantadine has anti-Parkinsonism effect. Amantadine and rimantadine mechanism of action, that is which will block the M2 protein channel, that is type A only, disrupt the hydrogen transport, viral uncoating in host cell, and therefore viral RNA transcription. Antiviral drugs, that is pharmacokinetics of amantadine, oral bioavailability is 50 to 90%. Amantadine crosses the extensively blood-brain barrier, whereas amantadine does not process extensively. Administered through the oral route. Neuroaminidase inhibitors, that is zanamivir and oseltamivir, influenza contain an enzyme, neuroaminidase, which is essential for the replication of the virus. Neuroaminidase inhibitors prevent the release of new virons and their spread from the cell to cell. Neuroaminidase, these are the effective against both types of influenza A and B. Do not interfere with the immune response to influenza A vaccine, can be used for both prophylaxis and acute treatment. So already I have explained about this. So whatever the drugs we have discussed, that is enalapril, amantadine, fluoxetine, purine and pyrimidine analogs, then methotrexate, rifampin, and inhibitors, I mean influenza, which are neuroaminidase inhibitor, which will block the influenza. So whatever the enfuratide, this will be blocks at the level of viral absorption and penetration. Amantadine, which will be blocks for influenza A at the level of uncoating of the viral synthesis. For formiviracin, that will be blocked in early protein synthesis in the treatment of CMV. So purine and pyrimidine analogs, which is also reverse transcriptase inhibitors, which is blocks in the nucleic acid synthesis. And methotrexate, which is for the protease inhibitors and which will be blocks at the stage of late protein synthesis and processing. And rifampin, this will be blocked at the stage of packing and assembling for the viral release. So acetylvir is orally administered and zanamivir is given through the intranasal route. Risk of bronchospasm are with zanamivir. The pharmacology of ribavirin, which is a guanacine analog inhibitor RNA polymerase, then antiviral spectrum DNA and RNA viruses are susceptible, including influenza, parainfluenza viruses, RSV and Lassa viruses. Ribavirin, which is treated for the RSV, that is distribution in all the tissues except central nervous system, administered through the oral route, IV, inhalation in RSV. Anemia and jaundice are adverse effects that are the minor adverse effect, and this drug is not advised for the pregnant women. Therapeutic uses for the ribavirin, which is a bronchiolitis and pneumonia, is hospitalized in children, which will be given by aerosol route, then Lassa fever. Ribavirin is an alternative drug for the influenza, parainfluenza, measles, virus infection, and immunocompromised patients. Hepatic viral infections, that is interferons, limavudine, then entecavir, then also ribavirin. So interferons are the natural protein produced by the cells of the immune system, and it is responsive to challenge by the foreign agents such as virus, bacteria, parasites, tumor cells, antiviral, immunomodulating, and antiproliferative action. The three classes of interferons, alpha, beta, and gamma. So alpha interferons, alpha and beta interferons are produced by the cells in response to viral infection. Gamma interferons are produced only by T lymphocytes and NK cells in response to cytokines immunoregulating effects. Gamma cells have less antiviral activity compared to a beta interferons. Mechanism of action, that is induction of the following enzymes, that is a protein kinases which inhibits the protein synthesis, oligoadenylate synthetase which leads to degradation of viral mRNA, phosphodiesterase which inhibits the tRNA. The action of these enzymes leads to an inhibition of translation. Antiviral spectrum includes HBV, HCV, and HPV. Antiproliferative actions may inhibit the growth of certain cancers like COPC, sarcoma, and hairy cells leukemia. Pharmacokinetics, oral bioavailability is less than 1%, administered intravenously, that is subcutaneous and intravenous, distribution in all the bodies and tissues except CNS and eye. Half-life, that is 1 to 4 hours. Adverse effect of interferons, acute flu-like syndrome, bone marrow suppression, flu-like syndrome, that is fever and headache, bone marrow suppressions, that may be granulocytopenia and thrombocytopenia, neurotoxicity, that is confusion and seizures may occur, cardiotoxicity, that may be arrhythmia may be occur, impairment of fertility. Therapeutic uses of interferons that is used in the treatment for chronic hepatitis B and C, that is complete disappearance is seen in 30%. HZV infections in cancer patients to prevent the dissemination of the infection. CME infections in the renal transplant system, patients. Uh, Condylomata acutea that given in the intralesional injections complete with the clearance is seen in 50%. Hairy cell leukemia in combination with zidovudine. AIDS-related Kaposi sarcoma. So these are the disease viral, the virus disease that is flu, influenza. The drug of choice is that is amantadine and alternative drug is remantadine. For RSV viruses, pneumonia and bronchiolitis, ribavirin and aerosols. HSV that is genital herpes, drug of choice is acyclovir and foscarnet. Keratitis, conjunctivitis, drug of choice is trifluridine, and alternative drug is idoxuridine and vidarbine. Encephalitis, the drug of choice is acyclovir. Neonatal HSV infection, drug of choice is acyclovir. Herpes infection, drug of choice is acyclovir, and alternative drug is foscarnet. VZV, that is in normal host, no therapy, but in immunocompromised host or during pregnancy, that is drug of choice is acyclovir and alternative drug is foscarnet. CME, retinitis, that is ganisacrivir and foscarnet. HIV, that is AIDS in HIV body, antibody positive with CD4 count, that is 500 millimeter cubic millimeter, that is zidovudine and protease inhibitor. Then HBV, that is, and HCV, that is hepatitis B and C, drug of choice is interferons. Thank you.